sorry, got some primum non nocere, which means do not harm. And that is something. Our mission is to integrate and balance physical, social, mental, and spiritual well-being of the individual, to maintain health and longevity, utilizing all those four aspects to prolong, maximize, and enhance quality of life. Everything in life really ends up, how do we live our life? Quality is probably the best way to describe it. Physical well-being to some people are just like this. You go out and have a wonderful lifetime, enjoy yourself, play, and this is health. Well, really, it is not 100%. Physical well-being is made out of the hormonal balance, nutrition or metabolic balance, mental well-being balance, and environmental habits and activities. All that represents one whole complex of the well-being or physical well-being. Hormonal harmony is actually one of the most beautiful orchestration that our body does. And since harmony is kind of represented to us as music, let's start to see as a music it is. In 1902, a British physician named E.H. Starling coined the word hormone to describe secretin, a chemical substance secreted by the small intestine to influence the pancreas or gland that produces insulin and regulates the sugar. Endocrine secretion was discovered, and endocrinology, science about hormones, was born. In the last century was characterized by the discovery of hundreds of hormones secreted locally and into the bloodstream by glands and other organs. Those investigators showed the first time that many diseases can be treated by replacing special hormones. So let's start with a comparison with the music. Well, if you have a musical harmony, we have to have a composer that will compose the music. We have to have a producer that creates the production of the music. We have to have a conductor of the orchestra that will conduct the orchestra. We have a first violin that leads the orchestra. We have an orchestra that follows the instructions. And then, we have harmonious music that is produced. How that correlates with our hormones? Well, it's very simple. This is a very old, and when I say very old, it is very old for the hormones that we know nowadays. This is from the textbook of endocrinology written in approximately 20 years ago. Since then, thousands of the hormones has been discovered. So the brain itself is a producer, or it's a composer, I'm sorry. Hypothalamus or midbrain is a producer. Pituitary gland, which is right there behind the nose, okay, is conductor. Thyroid gland is the first violin, and distant glandular tissues through the whole body is the orchestra. Together, they produce harmonious music known as hormones. Every cell in our body has hormonal receptors. We can actually call them as a music listeners. If music is out of tune and not in harmony, music listeners, body cells, will react to the music or hormones, and music listeners, the cells, will be diseased and become diseased. Actually, the whole process and whole thing of being diseased is disease of our body. Now, oops, okay. I'm sorry. Okay, there are two types of the hormones. Endocrine cells and exocrine cells. Well, they're all endocrine cells, but some release hormones into the bloodstream and some release hormones locally. The cells that are reacting to those hormones have what they call it hormone receptors. And we used to believe that hormone receptors, when the hormones reach them, are like a lock and a key. The key goes into the lock and turns the cells on. Well, that is not true. Unfortunately, we've been taught so many years when I went to medical school, that's when I was taught, well, those things are really nothing but antennas. And we'll talk about it later on. Every listener hears the music differently. Receptors are individualized. It is unnatural to give body hormones like substances that the body has no receptors to recognize, that are not bioidentical. It is impossible to rubber stamp prescriptions and prescribe the same hormones and dosages for each individual. We are not the same. That does not mean we are not equal. Every living being has different instrument or genetic impersonal orchestra. Every living thing is connected with all of the life and all of the universe. Function of the hormones helps regulate fluid surrounding the cells, metabolism and energy balance, biological clock, glandular secretion, immune system, controls growth and development, governs operation of reproductive systems, covers overall feeling of the well-being. Menopause is a natural stage of the woman's life. It signals the end of the fertility. It is technically cessation of the menses at the age of 51, which is average for US data. Real hormonal aging starts around 35 to 38 years of age, which we call perimenopause. Menopause can be natural or spontaneous, or unfortunately could be induced or artificial. In 1997, almost 500,000 hysterectomies with the removal of the ovaries was done, according to the United States National Hospital Discharge Summary. During the period of 1998 to 96, 39% of the 2,250,000 women that went hysterectomy for benign gynecological indication had elective salpingo-oophorectomy, which removal of the ovaries and the tubes, 8.3%. That rose the next year and declined the year after. There was a very famous professor of gynecology. I will not mention his name. He's not alive anymore. He used to lecture here in Chicago. He was one of the Chicago famous university chief. He used to lecture in Chicago and tell that every woman at the age of 41 should give herself birthday gift, remove the uterus and the ovaries. Well, I always was kind of rebellious, and I like things a little bit different. So I raised my hand, being at that time I was still in training. I was in specialty training, in residency, what they call it here in the United States. I raised my hand. I said, "Professor, I have a question." And he says, "Yes." So I said, "It is well-known fact that prostate cancer is caused by the testosterone." He says, "Yes, it is." I said, "Do you have your testes?" And that was just a general laugh. You don't castrate anybody. That's the whole issue. Right now, we know roughly about 5 hormones that ovaries produce. But we really have no idea how many hormones and subhormones are produced by the ovaries after menopause. So, by 2022, which is now, it is expected to be 51 million people in the United States in perimenopause and menopause. Following menopause, hormone production decreases significantly, which can lead to a constellation of the signs and symptoms. Now, if you lose your hormones, you cannot find them. You must reactivate your hormone receptors. And that's where receptors are being very, very important. Manifestation of menopause-related hormone loss can have a considerable impact on a woman's physical, emotional, and social well-being, as well as her own quality of life. This is the self-portrait of the not as well-known German artist who was once upon a time one of the leading models for the Elle magazine in Europe. And when she went in menopause, that's how she saw herself. So menopause brings depression, brings so many other things which are not normal. Hot flashes, mood changes, sleep pattern changes, acute cognitive changes, decreased sexual drive and response. This is all for the short term when menopause starts. Long-term changes are urological changes. Bladder becomes more rigid, and when you sneeze or cough, you lose some of the urine. Skin changes, skins become very dry. Cardiovascular diseases are increased. Osteoporosis, which is one of the major problems, cognitive decline, loss of self-esteem, depression, loss of sexual drive and response. Hormone replacement therapy, also known as HRT, has been shown to be effective in relieving many of those symptoms such as hot flashes, sleep disturbances, sexual dysfunction, and many more. The relief of menopause symptoms is the most common reason that women initiate or continue to use hormone replacement therapy. And this is just to show you how face may look after you lose the hormones. Well, what are the problems in menopause? Unfortunately, we physicians are really not well trained to give you information about it. They're confusing information. Insufficient counseling is the number one. In 2002, Women's Health Initiative was a sponsored study in the United States by the Wyatt medical company that used oral consumption of hormones. They use horse urine, estrogen called Premarin, and progesterone was synthetically altered so that can be patented. You see, we cannot patent natural things. So what happened is, within approximately 6 months, great number of the people became ill. They developed cancers of the breast, cancer of the inlining of the uterus. They developed heart problems. And what was very important, they did not start any study at all until woman was 15 years over into menopause. So if you shut off your hormonal things and start pumping now hormones, body is not accustomed to respond to it. So it became tremendous crisis in hormone replacement therapy. All the doctors were poo-pooing it. Nobody would recommend it. Women were terrified and suffering. And William's textbook of endocrinology, excuse me, published this in 2008. There may be small but significant risk. Now, how can be small and significant risk for increase in heart disease in hormone replacement therapy? So what hormones we should use? Should be always bioidentical. They're not actually human-produced hormones, but they're identical structure-wise, chemically, to human hormones. Estrogen should be used only through the skin. If you use estrogen orally, it goes to the liver and gets metabolized, and within 6 weeks to 6 months, it starts working appropriately. Progesterone is better to use orally only. Other hormones should be replaced if somebody is deficient, and every prescription should be individualized. No one size fits all. 6 reasons to consider bioidentical hormone replacement therapy: relief of the symptoms, prevention of memory loss, cardiovascular health, bone production, growth and repair, and normal sexual life, which means normal quality of life. What can we do to understand? Well, become observer. Information, information, information. Be mindful of what's going on. Be aware that you always have a choice. What testing should be done? Complete history and physical examination, pap smear and HPV testing, mammogram, bone mineral density, pelvic ultrasound if necessary, if it is warranted. CA-125 is a blood test for tumor marker of the ovarian cancer, and that is always a good test for the screening. And vitamin D levels. Nobody talks about vitamin D. And vitamin D is really not a vitamin. Vitamin D is a hormone. During the COVID epidemics at the University of Chicago, they tested 300 cadavers, people who died from COVID. And everyone there had totally low vitamin D. They could not believe it. So they another 300 cadavers, tested them, and they all had extremely low vitamin D. So vitamin D is extremely important. What hormonal testing need to be done? Total and free estrogen, total and free testosterone, progesterone, sex hormone binding globulin, complete thyroid panel, testing adrenal glands by DHEA hormone, and insulin growth factor 1. That is a growth hormone marker. Growth hormone actually gives you marker how old are you. Those who have extremely low growth hormone, they are not going to see great longevity. Unfortunately, replacement of the growth hormone, it never took great fancy because growth hormone has been guarded by all the governments in the world very carefully. It is harder to prescribe growth hormone for adult than to prescribe any opioids or any other severe drug. For one simple reason. If you have a growth hormone marker high or within normal limits high, I'm not saying out of proportion high, you live long. Those who were on a growth hormone, I had a colleague of mine here. I did those original studies of the growth hormone in 1984. And since 1984, he was using the growth hormone because his growth hormone originally was extremely low. He just recently died at the age of 112. And he also worked until he was way past 90. He was an eye specialist. So how often follow-ups should be? 3 months after initial visit and yearly after exam. At that time, it should be labs done. But what hormone, the hormones are fine, but do they have any risk? Yes, they do. Increased risk of breast cancer, increased risk of endometrial cancer, increased risk of the blood clotting, leading to the heart attack and stroke. Are hormones only solution? Well, herbals, homeopathy, acupuncture, Ayurveda. Unfortunately, none of this is long solution. So are hormones the only solution? Let's go back now to that original thing of cells. Hormones are biochemical substances that emit specific, extremely low electromagnetic frequency signals. Receptors are antennas that resonate to specific, extremely low electromagnetic frequency signals created by the hormones. Receptors act by the principle of resonant recognition model. If you remember from school, if you have two tuning forks and they're on the same wavelength, you hit one tuning fork, another tuning fork is going to vibrate. That is actually resonant recognition principle. Those things happen in our body all the time because not only hormones, but all the substances that we make in our body produce electromagnetic frequency that react with the receptors, which are nothing but extreme special electromagnetic frequency antennas. So resonant recognition model acts as a principle of the quantum medicine. Quantum medicine is based on the principle of quantum physics. So for those who are well informed about it, my apology if I bring you down to the basics of it. Quantum physics is a science that's studying minute particles of matter. Our body and everything that is around us is made out of small particles called atoms. Atoms are made of subatomic particles, nuclei, and electrons that surround those nuclei. We used to believe that electrons go around and circulate around the nuclei in the fashion same that the Earth goes around the sun. It is not so, they just vibrate. Those particles emit electromagnetic energy and they permanently vibrate at a certain frequency. Everything is vibration. Our body's the entire universe vibrates. This chair vibrates. My computer vibrates too. Quantum medicine is exploring behavior of the smallest living parts of the human body, our cells, on the level of the principles of the quantum physics. Every cell in our body receives and emits extremely low electromagnetic frequency called biofield, very similar to frequency that of our planet Earth emits all the time. This is called Schumann resonance, and that is approximately between 7.2 to 8.4 hertz. That receiving and emitting a healthy frequency must be the constant flow and in balance in our body for us to be healthy. In 1970, Fritz Albert Popp, a theoretical biophysicist at the University of Marburg in Germany, discovered that fresh cuttings for the plant emit light. And that is what he did. He placed just leaves in a dark chamber and took the photographs of it, and he was amazed that they glow. Everything glows. This is egg has been taken out of the refrigerator. And this egg out of the refrigerator not only glows, but it glows and glows and glows. When my wife saw this picture, she said, "I'll never eat egg again." Well, you're right, really, you have the same glowing, same frequency emission in your cucumbers, in your zucchinis, everything just glows. Anything that is alive has that biofield. Tip of the finger. Everybody here that is present, tip of the finger looks like this. If it is placed on a specific camera, and this is courtesy of Dr. Korotkov, who has that specific camera. That specific camera costs about $89,000, so we don't use it. But there is another camera which is much cheaper, and this is $2,000 camera. And then we utilize algorithm, computerized technology to measure our biofield. And we can do that now on everybody. And we can predict what's going on in our body. So there's a new modality. If normal energy flows is blocked, then cells lack normal energy food and are starting to emit abnormal frequency and create the background for developing disease by creating abnormal biochemical reactions. We never knew this up to probably 50 years ago. In addition, from outside source, by adding healthy and normal electromagnetic frequency for that tissue, we can unblock those energy channels or even prevent blocking of the same and facilitate support of electromagnetic balance that brings normal functions of the body. So hormonal harmony patches. Products utilizing that type of technology are developed and made in the United States in 2010 by Tuning Element LLC, Branson, Missouri. One of those products, by name of the Harmony frequency patches, are specific for balancing female hormones. Harmony frequency patches are distributed in Europe by Biofield Care Global and sold in the UK by Biofield Care UK. Harmony patches are 3 by 3 centimeter in diameter. Patches are silicone-based, infused with a minimal amount of metallic salt, which makes them dupe semiconductor with a high memory potential, which resembles quite a bit microchips. Patches are embedded with extremely low electromagnetic frequency blend, specific to resonate with the receptors of estrogen and progesterone, thus bringing body toward the normal hormonal function. Harmony frequency patches do not increase the production of the hormones. They only supply extremely low electromagnetic frequency of the hormone, therefore have no side effects. They do act with those receptors antennas, and that's how our body thinks that hormones are present. Person utilizing harmony frequency patches does not need expensive lab testing nor exams. However, we do encourage annual physical examination for general health. You do not need any of the testing that we were talking about because it will be useless. We are testing hormones in our blood. There is nothing to test once you have electromagnetic frequency because we have no way of testing electromagnetic frequency. Harmony frequency patches are completely harmless. They're not invasive. Harmony frequency patches do not have any medication, herbals, or electrical supply. Harmony frequency patches are passive medical devices and are activated by the human biofield. Skin acts as a capacitor when harmony frequency patches are applied to the body. Harmony frequency patches are FDA registered as a Class 1 medical device. Harmony frequency patches can help support natural female hormone balance, can help support normal menstrual cycle and aid in conception, can help support management in premenstrual syndromes, PMS, works as a charm, or actually as a charm for menstrual cramps, can support management of endometriosis, and can help support management of menopausal symptoms. Armory frequency patches are quite cute. This is the new design. They used to be square, now they're in a nice shape of the heart. You peel off the plastic cover off, then place the patch firmly on the dry skin, clean it if skin is greasy. The cardboard backing should be thoroughly wet by a paper towel or washcloth dipped in preferably warm water. Then after 10 to 15 seconds, press it firmly and peel off the white paper backing. Patch lasts 3 to 5 days. Patches are water resistant and not fall in the water. Armory frequency patches are to be applied to the abdominal wall, the lower and right quadrant on the acupuncture point, Zgong EXCA1, or on the top of each ovaries, which is exactly the same point. It is very important to notice that all our electromagnetic frequency patches will activate your acupuncture points if you place them on acupuncture point site. It is essential to maintain appropriate hydration for Armory patches to work appropriately. Structured water frequency enhances the effectiveness of the patches. We recommend use of the tuning element product AquaTune bottle that produces structured water. If you're ever interested in that, we have wonderful presentation on the water itself. Armory frequency patches reduce menopause symptoms 97% in double-blind unpublished study completed in 2019. There is no allergies or complication reported. There is no age limit when to start or stop them because there is no hormones in it. Over 5,000 women use Harmony frequency patches worldwide. Since then, we have with the same result. Aging is a disease, and it is treatable. Getting older with vigor and all the faculty is normal and achievable. If you're going to age or get older graciously, it is your decision. Be armed with the knowledge, know thyself, make your own decision. And this is bibliography that we published about tuning element patches. You're more than welcome to either contact me on those emails or just contact our host. I thank you very much.
Thank you very much, Dr. Srba. That was very informative.
Any questions? Any questions?
I learned a lot. And as we said at the beginning, I will ask Debi to follow up with discussion. So who doesn't know Debi, I would like you to know her. So she struggled with menopause symptoms for over 6 years before being diagnosed. And this resulted in a total breakdown. Now she is on a mission to raise awareness and eliminate the stigma of menopause. She also offers one-to-one coaching, a website full of free resources about menopause, and will soon be launching a 12-week program and a self-help book. So Debi, I hope you enjoyed this presentation as much as I did. And if you have any questions, please ask. And if anybody else wants to ask a question, can raise a hand, can send us a private message, and we'll forward it to Dr. Srba. So thank you.
Thank you so much, Valentina, and thank you, Dr. Srba. That was fantastic. I mean, I was very lucky to receive a preview of the slides, so I knew roughly what was coming, but there were quite a few things in there that I took note of that I didn't know before. And my life is now menopause, and I have studied, I have researched, I know an awful lot about menopause now, but there's obviously loads more still to learn, and certainly from specifically the hormonal aspect rather than, but these patches are, it's such a revolutionary way to think about treating the body, and the science blows my mind. I mean, I've actually got mine here, tiny little patch like this that can do so much. It's just incredible. And personally, I've had these previously and I ran out, but I've got some more this week, and I just put one on 2 days ago. And I don't know what's happened to me. And my energy levels are, they're not even through the roof. They're way further than through the roof. And, you know, I'm focused. I feel happy. I feel alert. I feel motivated. I've done more work in 2 days than I've done in the last 2 months, and probably longer than that, because I can, and I feel like I want to, and it's just incredible. And, you know, I don't know how many of you on the call, maybe you could pop some comments in the chat. Let us know what stage you're in with your menopause journey. If you are in menopause, if you're pre-menopause, if you're peri, or if you are post. Just be good to get a feel for who's here if you want to share that. I am 48 and I am now in post-menopause, but as Valentina said, I struggled for 6 years without knowing what it was, and it was horrendous. And 20 months ago, roughly, last Christmas 2020, I had a full breakdown, and I genuinely did not want to wake up. Eventually I was put on HRT, which literally has been a lifesaver for me, but I still really struggled with fatigue and the clarity and the focus. And I'm building my own business, as you heard, so I can't afford to not have focus. And literally this week has just been, I feel like that cloud has been lifted, and I'm just getting so much done. It's crazy. I mean, I'm ticking things off my to-do list constantly, and I can't believe the work I'm getting through, but quality work. You know, I'm not rushing it and just putting out any old garbage. I'm giving my best work, and it feels incredible to be in this place considering where I was before. So with regards to the presentation, I mean, thank you, Dr. Srba. That was so interesting and really informative. And just a couple of points really, that I love the part that, you know, disease is just dis-ease of the body. And I've heard that before. My business partner is actually a holistic specialist, so she's learning that terminology as well. And that very much resonates with me, that, you know, that's exactly what it is. Your body is not at ease. And we use that word so frivolously, but don't really understand what it means. So to get your body back into that alignment, how many problems and issues could be solved just by your body naturally working the way it was intended to work? I mean, that's phenomenal. And the comment about no size fits all, I couldn't agree more with that, because I speak to so many women every day who are on, you know, there's multiple different kinds of HRT, there's different doses, there's different combinations. Some people, it can take years for them to get the right kind of HRT, which in itself is a battle. And a lot of women will give up and say, HRT doesn't work for me. And maybe it doesn't, but maybe it's just they haven't been given the right kind. But again, you know, I am an advocate for HRT if it's suitable for you, but to take away that element of the stress of just having a simple patch to put on without trial and error, combinations, multiple patches, different brands of pills, whatever it might be, so simple. And, you know, these things just, I think every woman in menopause needs to have these patches, because even alongside HRT, I still take my HRT because of the future health benefits from it as well. But they work really well together. So yeah, there isn't one size fits all. And if any medical professional tells you that that's the case, then they're just not educated enough in the subject.
Just change the doctor.
Yeah, exactly. If you can, yeah, for sure. Go see Dr. Srba. But
Okay.
you know, I don't know what it's like in the US, Dr. Srba, but here in the UK,
It is the same.
Our GPs are just, I'm very grateful that my personal GPs have been amazing. I've never had a problem asking for tests and having them done, asking for medication and receiving it. But some women, my business partner included, who is just turned 40, and she's been in perimenopause for about 6 months now, and they refuse to even consider her as menopausal because she's too young. And that really, really winds me up, because I actually know people who have been in menopause since their teens, which is really scary, because they've gone through most of their life not knowing what's wrong with them and not being given the right treatment, whatever that might be. So the age thing is a massive thing for me as well. And you know, your presentation, 51 is the average age here as well in the UK for menopause. However, perimenopause, which anybody that doesn't know what perimenopause is on the chat, please pop it in the comments and we can maybe talk about that. But it's the build up to your actual menopause, when most of the symptoms happen. And in that perimenopause, that's now becoming something that happens to people in their 30s on average. So the 51 age bracket, certainly here, needs to be forgotten, in my opinion, because if you're not 51, you may be just dismissed as not, you know, you can't possibly be menopausal because you're not 51. I think people need to be more open to this age situation, because it can happen. In your teens is rare, yes, but you know, 20s, 30s, certainly your 40s, and people aren't aware. They don't know what's happening to them. They're scared. Many women think they're getting early onset dementia, and that is horrific when it's not that at all. You know, so age for me, I don't know what your thoughts on that are, Dr. Srba, about, do you think this age bracket needs to be removed? You know, do we start just talking about menopause, that it can happen at any time in your life?
The youngest person that I had in my practice over 60 years, believe it or not, was 21 years old. Mm. So menopause can be caused by lots of things. Can be caused by autoimmune disease, can be caused by everything else. But you know what? We have some other questions. So Mrs. Roberts had a question. So
yeah, just hi.
Hi, hello.
Hi, you're right.
Can you all hear me okay?
Oh,
yeah.
absolutely.
Oh, good. Yeah, that was amazing, by the way. Thank you so much. Thank you, all of you. I've only just joined Meetup for, you know, first time in a long time, for years. And weirdly enough, I came across your Instagram bio, Deb's, last week. So the coincidence is just mind-blowing. And when I saw this title, I just said yes. My story is very much similar to Deb's story. So my questions, I've got 4, but there's 2. I'll go from the important one to the least important one that I could possibly research myself for the sake of time, okay? But thank you so much, Dr. Srba. So the most important question for me is where to place your patch, because in your diagram, you've placed it in a position where if somebody like myself has had a a total radical abdominal hysterectomy with a vertical bilateral cut, then that your patch is saying to place it on top of that cut. And I'm really interested in your product, and it's the first time I'm hearing about it, but I'm a sound healer as well, and I'm a Buddhist. So so your talk, my whole body screaming yes, but the position needs to be addressed.
Okay, the position, look, regardless what type of the surgery you had, okay, short of somebody who has a large abdominal apron, okay, even that can be used. The main point is that you use it where diagram shows is that we use acupuncture points, because of the acupuncture points really address very easy transformation, transfer of electromagnetic frequencies. That's how acupuncture works. So, you know, just for one little understanding, how hormones versus patches work. If you remember, our great grandmas used to have a stove that you have to feed with either coal or thing to do the cooking, okay? So you had to have a physical presence of some substance to heat the stove.
Yes.
Now we have a microwave, and the stove is not even hot, and food will get hot. Microwaves act on the food. It is the same thing. Well, thank God the frequency patches are not microwave, okay? Because microwave is very, very dangerous, changes molecular structure of the food that you eat, and makes it automatically GMO, even if you bought the most wonderful food from organic factory, okay? So anyway, that is the difference, okay?
So if I place the patch above the navel, but in that same vertical, because there's acupressure points above the navel as well,
Try to put it exactly where it is shown, okay? Regardless, because that will be, you can put it wherever you feel like it will work. However, the best work is you start with the two patches, you put one on the left, one on the right side, and when they start fading out, you replace one. The next time you replace second, and you go one to another, one to another. So you always have a one fresh one.
So there's right and left. So it's not down the actual center. So because it's right and left.
Well, it is just on the side where your ovaries are, which will be approximately 4 finger breadths outside of the navel. Okay.
Yeah.
Okay. And then down at the level of the ovary.
I've got it. That's perfect. That's perfect. It's perfect because it's not down right in this, it's not in between the two. So it won't be on anybody's cut. And when someone's had a laparoscopy, again, they can go above or below that, but it still be in the place that you're saying. So that is perfect. Thank you so much for clarifying that diagram up.
Okay.
May I ask another question?
Before you do, is it Dion? Yeah. Before you do, I just wanted to ask, I put mine, excuse me, I put mine here. Dr. Srba, I did it wrong, because that's an option in the instructions.
This is also acupuncture point.
Mm-hmm.
So it is the meridian of the vessel. Okay. So as long as you do acupuncture points, it's fine. But the best is where we showed you. Those are the best results.
Yeah, I understand. The clarity is you do your best, but the best is the position you said.
Absolutely. Okay.
So that's awesome. So my second question, going of importance, is the growth hormone maker, the IGFI.
One.
Sorry, IGF-1. Thank you for that correction. Are there any foods that come close to that match that
Yes,
that one can substitute? Because it's not like I can go to my GP and ask for this. I would definitely get
First of all, if you go to GP and ask him to test you for a growth hormone, he will look at you, and even if you're low, if you ask him to prescribe you, do you know how much growth hormone cost?
Very expensive, I would imagine. That's why the answer would be no.
It's about $4,000 a month.
Okay, what should I eat? Tell me, what should I eat?
First of all, what you have to do is get your blood test. If you're normal, just regular exercise, physical activities will keep it up. If you're low, then you go to the health food store and buy L-arginine. L-arginine.
Can you spell that, please?
L-arginine. That's amino acid.
Nine is N-I-N.
Okay.
You're so kind. Dealing with my dyslexia now, you are.
L-arginine. Can you see it?
Yeah. Yes, perfect.
Okay. Okay.
And
You start with a low dose. Okay, you start because it comes as a powder. You start mixing it with the water or whatever, and start with the 1 gram and go to the, depending how low is your growth hormone. What that is, L-arginine is growth hormone releasing factor. So if you have reserve of the growth hormone, will activate it. However, if you have absolute lack of the growth hormone and if you remember what I was showing you, your composer in the orchestra does not write that thing, that will not have effect at all. In that case, you will have to have a growth hormone replaced.
I get what you mean, but I think one could kind of maybe estimate that if someone's really, really low, then that would equate that they also are really, really sick.
The normals depend on the lab that does it. So just ask your physician if he would prescribe IGF-1 blood work, and then go from there on. Okay.
Thank you. Bless you. Can I ask another question, or does anybody else have any questions? Do you want me to pause?
You know, some other people are waiting too, so.
Yeah, okay. Thank you so much. Thank you.
You know what, if you have any questions, last slide shows my email. You can ask the host, she can give you my email. So,
And also, if I wanted to sell your product, who do I get in touch with?
pardon me?
If I wanted to sell your product, one, I want to buy it. Two, if I want to sell it, who do I speak to?
Okay, this lady here, Valentina.
So are you UK based? Then you have to talk to me. Yeah, I already put your name down, and I'll message you privately with my email. If anyone has any other questions, it's info@biofieldcare.co.uk. I'll put it in in the message.
How do you spell biofield?
BIOFIELD
Yeah.
CARE
Yeah.
.co.uk, and I just place it in a group chat.
Okay.
And Caroline, did you have a question?
I did have a, yes, I mean, I've written some on the chat thing, but I was just inquiring. I have a daughter who's 19, and she's experiencing a lot of teenagey stuff. So I'm just wondering how
PMS, premenstrual syndrome, anxiety before.
Well, you could put that. It might be a bit more than that as well. But it's just being a teenager generally is. But I'm wondering whether these could help something along those lines. Yeah.
Well, here is the answer. Okay, if this is hormonal, so please take a notice if this is prior to cycle, about 10 days prior.
It can be, yes.
Okay, then this will help her.
Yeah.
If this is something that is not associated with cycle, then BE well patches, and Valentina has them both, okay, will be very, very helpful. BE well patches are originally produced by tuning element for ADD and ADHD for children with attention deficit disorder. However, we found out it works like a charm for any kind of anxiety.
She has huge anxiety, yeah.
Yeah, as a matter of fact, I had one attorney who had stage anxiety, which is devastating for attorney, okay? He has to go to court and go to court and falls apart. So he's been using it with a great success without any, he was for years prior to this, he was on all kinds of the tranquilizers and everything else. So he finally started losing a little bit memory because of the tranquilizers. So he changed it now, okay?
Okay, thank you.
You're welcome.
But I did quickly, about me, I was saying that I'm post-menopausal, and I think you've written something about, well, just if you think it might help the energy, but also lack of libido.
Have you asked your GP about testosterone?
No, I am interested in that. But I'm not. But I'm also a bit scared of it because I've had breast cancer way back, and I don't want to sort of muck about too much. I've been using a bioidentical cream, but that doesn't have that in. And I think, to be honest, if I went to my GP and said something about that, I just don't think they. I can hardly even get an appointment there at the moment. So
yeah,
they don't even answer the phone. So I don't think. I think
patches will help you definitely. Patches will help you definitely.
Yeah, I mean, I can't comment on the libido because I don't even know what that is anymore. I haven't had a partner for, I don't know, nearly a decade.
Well,
so
I don't know about that. I can't keep up if I do. So when I did have one, it was like, I'm really not interested, so that's not a great start, is it? But Dr. Brasovan, you just said something then, didn't you? What did you say about that? It definitely would help. Dr. Brasovan?
Okay, can you repeat the questions? I'm sorry.
What about the libido thing?
It will, Harmony will help the libido definitely.
Okay, well, that's...
Absolutely.
Is for libido, where would be the best place to place the patches?
Same place.
Same way.
Yeah.
Because once you're targeting your hormone receptors.
Yes.
Yeah, that's all.
Okay, thank you.
You see, libido depends on two hormones. One is testosterone, and second is oxytocin. Okay, so this will work with both.
And
Something-
where can we buy these things?
Directly
Right,
on the
from
website
Valentina.
from Valentina.
But I don't
Yes.
have that, so
It's in the chat. The link is in the chat.
it is.
The link is it's biofieldcare.co.uk.
Okay, it's the
the
same
sa-
thing. Yes.
As me email, yeah.
Okay. Yeah. All right, I shall have a look.
Great.
I just wanted to say, actually, vitamin D, I didn't know wasn't a vitamin. That's news to me. So yeah, that was really interesting. And I've started taking a lot of vitamin D medication lately because, you know, firstly, I'm from Scotland, and so most of my life I haven't even seen the sun. But now I'm inside working on my business a lot, and even in England, there's still not that much
you don't
sun
get
at this
much,
time of year. So vitamin D is rare. And I don't know if it's had an effect or not, to be honest. I hadn't noticed much change. The biggest change, honestly, hand on heart, is when I stuck one of these on my leg 2 days ago. So they do something, that's for sure.
That was good.
And we can take credit for your energy. I've seen on Instagram you're very active. I didn't know it happened after you placed the patches. So that's
Yeah,
good.
this week there's been a big shift this week. So yeah.
That's good.
The vitamin D, Debs, was going to be my fourth question. I was going to ask Dr. Sabah if he wanted to expand upon that a little bit. Like, where did it get lost that we think it's a vitamin and not a hormone, and what brings you yourself to that conclusion
Okay.
that it's a hormone?
I'm
if
going to
you
have to go, folks. Excuse me. Bye-bye. I have to go, but thank you very much.
You're welcome. Okay. What was the question again?
How is it that we're all misinformed that vitamin D is a vitamin and not a hormone? And
Look, vitamin D is essential for everything. But vitamin D is kind of help with all the productions, okay? As far as sexuality is concerned, if you do not have a sufficient amount of vitamin D, your testosterone and oxytocin receptors will not be functioning appropriately. So you see, everything is a harmony. That's the whole issue. The whole life is a harmony. We all produce our electromagnetic frequencies. They all interact. We're connected not only between us, not that you're connected only with your family, with your friends, and that you're connected with the UK and entire Europe and the entire world. We're all connected with the entire universe. Now, that little spark of a biofield goes way out of our galaxy. Okay.
So how do we produce vitamin D in the body?
Okay, how do we produce vitamin D? Vitamin D, okay.
Yes.
By sun exposure.
Yeah, but like what does that then do? What's the actual chemical process in the body for that to happen? I mean, yeah, I know we need the sun.
Well,
But...
it's a photosynthesis, okay? Vitamin D is activated by the skin, precursors, and produced by the skin. However, in this time of COVID and everything else, vitamin D was essential for our individual disease resistance, okay? So if you had vitamin D low, you're in trouble. But let's talk about what is the low vitamin D, okay? This is one. You know, in the United States, I don't know in your labs, it is normal between 30 and 100. But if you think about a bell curve, okay? If you think about the bell curve, it's not normal here, it's not normal here, it's normal in the middle. And all the physicians that I know, they will see 30 and say, oh, you're fine. You're not fine. normal vitamin D level by our standards and our labs is between 60 and 90. And not many people do that. I take, during this period of time, just to help my immune system, I take 50,000 units of vitamin D once a week. That's a capsule, it's a prescription. Every week I do.
Yeah, I take daily as well. I had a whole week of where I took, I don't know, 3 of the pill. They're each 10 something. I don't know the measurement, but I would take 3 a night for a week, and then I take 1 a day every day.
Okay.
Because we don't have as much sun as you.
Do you take it with the greasy food?
No, I take it at bedtime. Oh.
Vitamin D, vitamin A, and vitamin E are fat soluble. Unless you have some fat in your stomach, I'll beg your pardon, you'll poop it out next day, that's it.
I'm trying not to eat fat food. I've got enough fat on my stomach, thank you.
Listen, when I talk about fat food, I'm talking toast with a little butter on it, that's it.
Wow, okay, that's really interesting.
Okay. Something very small.
Yeah.
Okay. But something you have to have presence of the fat in order to be absorbed.
Wow, okay, thank you.
You can take it with a glass of milk if you like milk. Okay, that's it.
Okay.
How much vitamin D do you take? Well, how many units?
It's tiny little pill. It's 10. I think it's 10,000.
Pardon me?
Would it be 10,000?
10,000? That's significant.
Yeah.
That is a lot. Be careful. Have your blood test done. Because if you get over 150, you can develop hypervitaminosis of vitamin D, and that can cause lots of problems.
Gosh, okay. Yeah, I get my bloods tested all the time anyway, so that's...
What was your last vitamin D level?
Oh, I don't know. They don't tell you what the levels are. They just tell you if it's normal or not.
Well, again, what is normal? That's what I'm talking about.
Exactly.
So you have to be proactive. You have to know thyself. Okay.
Great. Well, my vitamin D levels, I will take my vitamin D at a different time.
Oh, you can take it at bedtime with just 1 sip of milk. That's it.
Sure. Okay, that's great.
But don't take it with the skim milk.
Okay.
And don't need more than 1 sip. Okay.
Yeah, perfect. Thank you. What else did I have? Oh, I'm really interested to know about the water that you spoke about.
Oh, how about Valentina, would you like to talk about water? Sometimes schedule the whole thing about water.
We can schedule something about water. Yeah. I'm just sorry, I got my water here, but it's not in the bottle. I can't show it right now. It's very interesting. I've been drinking it now for a while. It's actually tastes really good. But yeah, we could schedule. Oh, my assistant just brought me this.
And here's one I made earlier.
So, this is a water bottle. It's very nice, and it made structured water. And it would be really nice to talk about it. Yeah,
I would love to.
It's a topic that I think would take another webinar, right?
Water is the most misunderstood substance on the earth.
Yeah.
Without water, there will be no life.
Yeah, and too much water, there's no life. That's the flip side, isn't it? It's a balance.
No. Look, our body has 99.99 molecules of the water inside. Our body contains anywhere between 60 and 70% of the water altogether, but the molecules of the water are present almost in every single substance that our body has. So it's very interesting. And water has a tremendous memory.
Oh.
Yeah, we talked about it, and it's very interesting.
Oh yeah.
Yeah.
Dion, schedule it.
She said.
Okay.
Dion, go ahead.
I've got one last question. Thank you, Dr. Saba and Valentina. It's about the I may not pronounce this correctly, the Premarin, HRT, the one that's made out of horse urine. Everybody, I know. Sorry, Debs is shaking her head vigorously. No. Besides,
Yucky.
because some people are just prejudiced against it because it's horse urine, and yet still those people,
It's not a prejudice.
But I'm just saying that some people have that about it, and yet still they eat meat.
No,
And
it has
they don't
nothing to
realize
do.
that.
It has nothing to do with the prejudice. Okay, the thing is, you see those little antennas called receptors, right?
Uh-huh.
Your hormones that your body makes are made of the different molecules that make electromagnetic frequency that resonates with those receptors. Premarin is horse estrogen. It's not human estrogen. So the receptors are not the same frequency. And that's why Premarin can cause lots of problems, because it's not bioidentical. Premarin is foreign to the body. I have nothing against horse urine. If we get some good hormones out of it, that will be compatible with us, but it is not. Also, progestins that they use in a Premarin are artificially modified so they can patent it. Your regular progesterone, you cannot patent because it's natural, okay? So they modified regular progesterone to progestin so they can be patented and charge more for it. And that also has not the same frequency. So
Progesterone is the same as well.
pardon me?
Progesterone hormone is made in a very similar vein as well.
Well, progesterone is the normal hormone that can be made out of the yams and other natural substances. And it can be perfectly identical with the human. But if they make it identical as a human, then they cannot charge extra. They cannot patent it. So they changed one molecule there and made it progestin so they can patent it. It's strictly business, has nothing to do with medicine, but it is a wrong medicine. That's the whole issue. So it is the same thing as you would try to put the square block into a round hole.
Yeah, we don't, our NHS here, you won't get Premarin anymore in the UK. You can probably buy it through a private practitioner. Why you would want it, I don't know, because Dr. Srba says it's not identical to human, but NHS will give you, we call it body identical. So you'll get body identical HRT from the NHS here if that's what you wanted to do. Various formats, but the presentation was correct. The best way to have your estrogen is transdermally with a separate progesterone taken in a pill format.
When did it go out of extinction then? Because hospitals were still giving it out. Because you're in Scotland, and I don't know if it's different in the England.
No, I'm actually in England. I'm from Scotland, but I live in England.
They were still giving it out 5 years ago.
Yeah, it's quite recent, and it's still, there's a lot of press articles that still use photographs of it, which drives me nuts. But yeah, you won't get it now. All the HRT given by the NHS is based on the YAM.
So thank you very much, Dr. Srba. I take your words in the same way that I see cow's milk. Cow's milk was meant for calves and not for humans. And when you're saying that about Premarin, I see it in the same vein as why and how I'm not a cow milk drinker other than in tea. So I hear it in that same vein. Thank you.
Oat milk all the way.
No species of the life drinks milk after breastfeeding.
I hear you. Thank you so much. And I love your sense of humor as well. It's been really, really good having you. Thank you.
Well, you're more than welcome.
So
No,
I think, Debi, do you have any additional?
Janet, yes, absolutely. Patches are for perimenopause. Patches are for PMS. Patches are for menstrual cramps. Patches are for endometriosis or whatever ails you hormone-wise in the female life.
Yeah, that was the question in the chat.
As a matter of fact, patches will help in problem pregnancies. You see, what patches do, they balance the hormones and make your ovaries work well, makes them happy. Your ovaries become happy, and that's all to it. Excuse me.
Okay, so I think we perimenopause or patches okay for this, so we just answer that question, right? They're basically for any stage of menopause or any other woman problems. Thank you, Debi. Thank you, Dr. Srba. We really appreciate it. It was
You're more than welcome.
Yeah. So looking forward to more of this in the future.
Thank you, everyone.
Thank you, everyone. Have a good evening.